question. I know I'm saying that over and over, but your guys' questions are so good. It really depends on the grief. If the grief is crossed into what we call pathological grief, or the grief has triggered a major depressive disorder, then yes. But grief in of itself is a normal response to a loss. And so no, not necessarily. Okay, I'm going to do a quick recap because I've been yapping. You guys, I'm a psychiatrist. I don't give direct medical advice. I'm here to spread some advocacy, talk about some general topics. As I've said before, what's most meaningful for me is the follows. I do not accept any money on this platform. I make absolutely nothing off this. So I just really appreciate the interaction, being here on live, trying to spread some awareness. Hit the follow button if you don't, is what I'm trying to say. All right. Thank you for the heart, Kay. I appreciate it. All right. Gosh, so many questions. Do I prescribe a lot of Prestique? I don't. Thoughts on Lamictal and Abilify? Like the combo, it could be done. Lamictal is a fabulous medication for bipolar depression specifically, and Abilify has a few different indications. It's helpful for an add-on for major depressive disorder. It's helpful, obviously, for schizophrenia. It can be helpful for irritability associated with autism, and obviously a few other things. What made me get into this profession? I really loved working with the patients. And when I was a medical student and on psychiatry rotations, I just found that the time that I spent with psychiatric patients, and I did a lot of inpatient work, was just incredibly rewarding. I thought the illnesses were super fascinating. I really like that it's not black and white, that there's a lot of individualization of treatment. There's a lot of things we don't know. So it's a very kind of, from my perspective, it can be a very fun profession to be in because there's constantly new things coming out and new research happening. So that's a real quick answer. Thoughts on Ritalin? Yeah, it's a treatment for ADHD. Okay. Difference between bipolar 1 and bipolar 2. Good question. So let's just kind of say this is a mood scale. So mania is up here, really elevated, talking really fast, getting into trouble, people notice, not sleeping, likely end up in the hospital. And then there's hypomania, which is what's experienced in bipolar 2, which is less, and usually you don't end up necessarily hospitalized. The behavior doesn't quite get to that extent, but still really elevated, really racing, talking really fast, out of character. Then there's kind of normal mood. And then there's dysthymic mood, which is like a lower grade depression. And then there's depression. So if you follow, bipolar 1 is mania and depression, and bipolar 2 is hypomania and depression. All right. Andrew, you helping out in my chat. I appreciate it. Do I still see patients? Yes, I see patients in person. I saw a full day of clinic today. Thoughts on when? Oh, this is a perfect question for me. Thoughts on if and when to start therapy for a child with a chronic illness. So my main job, I have a lot of jobs. I do consultation liaison psychiatry, which is psychiatry for the medically ill. And I actually work with children. So with chronic illness, a lot of times, yes, there are definitely some additional needs. It very much depends on the illness. So there's the factors related to having an illness, right? If you have something that makes you different as a kid, or you have something that takes you out of school a lot, there's going to be a lot of kind of additional factors. And then there's actually things with some illness. I think you have to know specifically what effect the illness has had on your child. Sometimes checking in with their doctor that's treating it, and then also looking at the illness itself and see, does it cause any mental health conditions? And I'm kind of a believer, if you're thinking about therapy, you can always meet somebody and they can tell you honestly if they think it's a good idea or not. Like having a little check-in and gaining support skills can always be helpful. Okay. Does Ritalin make Tourette's worse? Some stimulants can make tics worse. Yes, they can. Do they always? No, they can. Okay. Like you guys know, I'm waiting on a dryer. So I have like 10 more minutes before I have to go get my stuff out of the hotel dryer. I am having such a hard time finding a chronic illness therapist that can understand. So sometimes, depending on what your condition is, sometimes the support groups or Facebook groups can be really helpful for connecting with therapists that are trained in the area. I mean, for oncology, like cancer patients, that's quite the right word, have like fairly well-established networks. And so there's therapists associated. But it can be difficult if you have a chronic illness that is less common or more of an orphan illness, as they call it. So definitely looking and getting recommendations from other patients or your physician. Like if you're working with a physician that specializes, a lot of times they'll know a therapist that's been working with a lot of their patients. Amygdala cause an autoimmune disorder. No, I'm trying to think if it could trigger, like if you had an autoimmune disorder, could amygdala trigger it? I'm not finding the mechanism in my head right now is how I'll put it. Okay. What time is the live ending? Oh, Janine, when my laundry's done. It's ending in about 10 minutes is the answer. Yes, Laura, you answered about 10 minutes. But guys, I try to do lives as much as I can. But if I'm not answering your question, like I said, just go throw it in the comment on another video of mine. And I'll try to get to it later. And yes, nice to see you, Janine, by the way. Dry mouth and ADHD medication. Ooh, dry mouth is a tricky one. It actually like affects dentition too. So there are some medications you can use for dry mouth. It's a common side effect of something like clozapine, for example. There's actually like these saliva inducing pills. Thanks for all the roses, Andrew. You're distracting me from what I'm saying. What? 14, 16, 18, 20. Oh my goodness. Oh my goodness. I don't even know what to say. I don't think I've ever received this many roses. You're just blowing me up. Thank you, Andrew. Very, very kind. Okay. Ainsley, that was 44 roses. My goodness. Ainsley, I'm going to go to my first appointment with a psychiatrist tomorrow, and I'm so nervous. As is everybody else who went to their first appointment with a psychiatrist. I assure you, I don't know, anyone in the chat can tell you, but I'm pretty sure nobody went in to go see their psychiatrist for the first time feeling like super confident. The nice thing is, as a psychiatrist, I know it's incredibly nerve-wracking and I will do everything to try to make you feel more comfortable. For your first appointment, I mean, usually just be prepared. It is a lot of questions, but the thing I always tell people is don't feel pressured to talk about anything you're not ready to talk about. Yes, you'll likely be asked if you have trauma in your past, but nobody is expecting you to spill all the details. It can literally be a yes or no question. And you can say, yep, I do. And I'll get into that at another appointment. So that's kind of the biggest thing, because sometimes people feel this pressure, like they have to say everything in the first appointment. So you don't. And I hope it goes well for you. That's a huge step. And please be assured your psychiatrist knows that you're going to be nervous. Okay. What do you think about magnesium for anxiety? Oh, Natalie, good question. I actually have a video planned on the topic, and I was reviewing the latest research. And the thing is, it's so mixed. This is the difficulty with magnesium. Some studies show it could be helpful. Some studies show it's not helpful at all. And then anecdotally, you'll see people like, gosh, on TikTok, everyone's saying magnesium cured my anxiety. So it's kind of an interesting situation where I was talking to a patient actually literally today about it. And if you want to try it, great. It could help you. It could not help you. Some of the magnesium supplements are expensive, but relatively speaking, I'm trying to like give you there's lower risk. So it's something that I think has some evidence, as opposed to there's some supplements where you're like, don't waste your time, don't waste your money. That's not going to do anything. There's like some company that's like, I don't know, advertising stickers that like, oh, if you put a sticker on, it will help your anxiety. And I think it's literally a sticker. So, okay. Before I stick my foot in my mouth completely. How to know whether to go to a psychiatrist versus a therapist? Well, one, kind of depends on what's available to you. So in Canada, for example, psychiatrists are covered under the medical plan, so you don't have to pay for them, whereas therapists aren't. And depending on your insurance, it might be a different kind of payment. Also would depend on the severity of your illness. So anxiety and depression, you could start with a therapist. If you're concerned about bipolar disorder, schizophrenia, something like that, you might want to start with a psychiatrist. But usually starting with your primary care physician, your pediatrician or whoever, and asking them what they think is a good first place to start, because they'll have a sense of your individual situation. Some people say like, oh, if you want medication, go to a psychiatrist, but a psychiatrist, they do a lot more than that. Some of us do therapy. We do help with diagnosis and assessment. And therapists do diagnosis assessment and therapy too, and work very closely with us. So, I mean, ideally you'd get both. Okay. Let's